Daily Planet began in 1969 as a small program of Jewish family services. If you think about the upheaval and all the things that were going on during that period of time, there were young people dropping out of school, dropping out of society. They were just disenfranchised youth. So Ann Lane, the executive director of Jewish Family Services at the time, decided that she was going to take some of her money from one of her budget and she was going to start this outreach ministry to this youth who were living on the street.
What she did was she caught a bunch of social work students from the School of Social Work and she said to them, go out there on that corner, wander around, meet people, identify yourself as a social worker and see what's going on. And so that was really the origin of the planet. And then out of that they established a drop-in center.
As a couple of years went past, it was realized that the need in the community was much larger than a small little line item in someone else's budget. So they decided that a new nonprofit should be organized in order to serve the community need.
As far as our name, it's interesting. Everyone always asks the question, where did you get your name? Back in the 70s when we first started, we were a drop-in center for teenagers. And the then executive director asked the kids to name the program. They decided it should be called The Daily Planet because it was like Clark Kent going into a phone booth and coming out Superman. They felt it was a life-changing experience for them, and so that's what they came up with as a name.
So in honor of Clark Kent's employer, The Daily Planet, then this new organization should be called Daily Planet. And the very first logo was a little red phone booth.
The way I describe the growth of the planet, which had to do with the exponential growth in homelessness during the 80s, is that when I went there, we had 300 clients a year. When I left to go do doctoral work in 1992, we were serving 6,000 people a year. So it was a period of, rapid expansion of homelessness across the country, and Richmond was no exception. We coalesced with a bunch of other agencies in town to try to respond to this growth in homelessness, and that led to the opening of the Street Center in 1986.
We started serving homeless services as a resource with case management services, shelter care, and in the late 80s, early 90s, we actually began health services, and that was how we began our evolution into what we are today.
The Daily Planet was located on Canal Street, about 3 blocks from the current location that we're in right now, which is West Gray Street. And in many ways, it was sort of a split organization at the time. The health center had been a part of the Daily Planet organization since funding became available, and we had some contracted providers that came and did some very limited kinds of health services. As the healthcare for the homeless portion became more of an opportunity for growth, we moved the healthcare for the homeless to this location. That was in '97. We had medical services, we had part-time dental, and we had 4 hours of psychiatry and some social workers. In the meantime, everything else that was Daily Planet was going on Canal Street. At about the year 2000, there was a move to bring Canal Street operations here. We ended up having a drop-in center down in the basement. We had showers, laundry, we had a vocational educational and training program, we had a couple of things that were sort of carryovers from Canal Street.
In 2002, Peter Prizio came along and he took a struggling organization and helped grow it to one that is really well known and well respected in the community.
I presented a 3-year plan as part of my interview on the reconstruction, first the tearing down and rebuilding, if you would, and then going from there. And there's been no looking back since then. In 2014, we opened a new clinic on the south side of Richmond called Southside Community Health Center. That clinic provides primary health, behavioral health, and vision care.
It's a 3-story building, and the bottom floor is the clinic, so a miniature of this entire building. And then the top 2 floors is our medical respite program. So that's for folks who are, they don't have to come from the hospital, but many times they're being discharged from the hospital and need a place to go to convalesce. And so they can go there for at least 30 days. And then our Safe Haven program is our transitional housing program. There are 21 beds total. Currently, it caters to veterans and to those in the Ryan White program. We used to have a laundry and shower program. So anyone in the community could come for that. They were able to enter from a side entrance. And so with the growth that we were having and assessing the needs of the community, we had to make some decisions. And so laundry and shower went away, and we renovated that space for our medication-assisted treatment program. I think it was definitely a tough decision, but as an organization, really looking at, what is our role in the community? What is that we're doing? What is it we want to be to the community? How can we serve the most people?
In 2017, we started our medication-assisted treatment program. DMAS, Department of Medical Assistance Services, began a planning process called the ARTS program, where they were bringing organizations together to plan for when Medicaid would be allowing billing for people who are suffering from opioid addiction. We began that program with 1 patient in there, and then 2, and then 3, and we have gone over the 150 patient mark, and it is the fastest growing program that we have. One of the myths that exist in our community, because we have been serving a homeless population and we continue to, people still thought of us as what we were back in 1969, serving a meal and providing a safe place to sleep. And so we went through about an 18-month process of interviewing individuals in the community and our community partners, patients, and we realized that Daily Planet has name recognition, but not necessarily the understanding of what we do within our work. We decided in 2017 to add health services to our name.
We're not the same old Daily Planet. We still clearly serve the homeless population and provide other services to all of our patients, but overall total health is our service line.
Part of our logo change was there were dots. And so a part of that tagline of sorts is connecting the dots, because that's what we want to do. We want to connect the dots. When a person comes in and there are a couple things here, something there, we want to connect the dots internally and in the community of services and things that could benefit them to promote their ultimate health.
This building looks a lot different today than it did 17 years ago. It's been renovated now twice. We've been able to add more office space, double the size of our health clinic, our primary health clinic, double the size of our oral health clinic. When I came, we had 1 part-time behavioral health clinician, and that represented the whole behavioral health program. Today, we have a behavioral health coordinator, 7 licensed therapists, 3 psychiatric nurse practitioners, and a psychiatrist. So that program has grown tenfold.
Peter has since retired. We hired a new CEO, Beth Merchant. She started in May of 2018, and she has done a remarkable job.
I am thrilled to be a part of this organization that has been in existence for 50 years. In the 1960s, it was working with college students. In the 70s, it was working with vets who were returning from Vietnam. In the 90s, it became a federally qualified health center. And now we have a very vibrant MAT program, medication-assisted treatment. So its ability to quickly respond to the needs of the community is one of the factors that has allowed it to be in existence for so long.
We are, throughout 2019, celebrating our 50th anniversary with gusto and different events. We just are making sure that people understand that we're 50 years old and we're here to stay.